And today marks 1 week since the start of phase 3. Public health experts tell us every step towards full reopening comes with the risk of larger spread of COVID-19. CBS 17's digital reporter Judith Ratana is digging deeper into the data to find out what we may see in the coming weeks.
I do worry that we may see a continued uptick in the number of cases over the next few weeks.
Dr. Permar warns COVID-19 spread could worsen with colder weather and businesses drawing people indoors. She says we need to continue mask use and social distancing,
so that we can keep these businesses open and not slide back in the phases because of increased community transmission.
Transitioning from lockdown to phase 1, the 7-day average was over 400 new cases a day. It crept up to more than 700 new cases a day by the end of phase 1. Moving into phase 2, the average for new cases was about 600 a day. 2 weeks later, when scientists say we see the full impacts of reopening, the average was about 1,100 new cases. Leading into phase 2.5, we had 1,500 new cases a day. That dipped to just over 1,300 as we moved into phase 3.
Until we really have a vaccine in place that's going to help prevent new cases through generating protective immunity, it's very unlikely we're going to get to 0 cases.
Overall, we saw a 76% increase in cases following phase 1, an 81% increase after phase 2. Holiday or summer travel may play a role. A 13% decrease after phase 2.5 could be due to less summer travel. Dr. Permar says we need more data to show the full impacts of phase 3.
The opening combined with cold weather, combined with holidays, it could be a very trying time for us in the coming weeks.
If you want the full picture from the very first COVID-19 case all the way through today and when the pandemic hit the state the worst, we're tracking that for you online at CBS17.com. I'm digital reporter Judith Ratana, CBS 17 News.